COVID arrived in Maine on March 12, 2020. It wasn't a surprise. We were one of the last states to report a case, and luckily we'd been preparing for it, meeting with our staff, talking to MHA, state health officials, and our colleagues at other hospitals. On March 15th, Governor Mills ordered the postponement of all non-urgent medical procedures, elective surgeries, and appointments. And seeing what was happening in other states helped us to redirect these resources and further prepare, even though at the time a lot of the locations didn't have many, if any, COVID patients. Hospitals quickly started setting up mass testing centers. Many hospitals pulled staff from other roles to screen people at the door and train for potential redeployment to expanded COVID units in both outpatient and inpatient settings. It didn't matter what your role was, everyone wanted to help, because that's what we do. Those early days were so scary. We all saw what was happening across the country with healthcare professionals dying from COVID-19 after contracting it while caring for their patients, and we worried that would happen in our hospitals too. Luckily, here in Maine, we were able to learn from the places that were hit harder earlier. We also had adequate PPE for the most part and adopted early universal masking in hospitals, which helped to keep our care teams safe. One thing that was striking was how hospitals and systems really came together. We shared information and best practices, and sometimes even supplies. We really operated as one healthcare system throughout the state. When vaccines became available, we rallied. This was our Rosie the Riveter moment as we set up large-scale clinics and provided our communities the trusted information they needed, helping Maine to achieve one of the highest vaccination rates in the country. That level of cooperation isn't seen everywhere. It's one of the reasons Maine has done so well during the pandemic. We've all put egos aside and worked together our Maine way, with collaboration and cooperation. We all know too well the hardships that came out of needed visitor restrictions, especially on our patients' families and our caregivers. Throughout the pandemic, many nurses have held up phones or iPads so family members can talk to their loved ones. Sometimes these conversations were the final goodbyes. It's gut-wrenching and has happened far too many times, but these care team members continue to do it when called upon, day after day after day.
You guys need a hand?
We come to work every day.
You good?
And we know it's going to be a hard day. Every day is going to be a hard day.
If you're not here, you don't realize, what goes into a day.
I've been a nurse for 16 years.
I've been here at Maine General for 32 years.
15 years. I've never seen anything like it.
It's everybody coming together for one common goal and working hard.
When the shutdown occurred, it just changed everything that we did.
We were faced with the unknown. It was a frightening time, really.
You're hearing about all these new cases.
But until it gets here, you don't know how it's going to affect your population.
Everybody was really scared. In the hospitals where everybody turned.
We had questions, and the great thing was having a hospital that was answering those questions.
All of our work was out in the community, and then all of a sudden we weren't allowed to go out into the community.
You have to be able to roll with the punches and adapt.
We had to change our methods pretty quickly.
Mary changed all of her group exercise classes. She got all of them on Zoom.
They asked the sports medicine team if we would oversee daycare for our staff at Maine General.
In home care, you had to be very creative in how you cared for patients.
We were then asked to be redeployed to the nursing homes. Patients not able to have their families in there. They didn't know us at all. Here we are holding the hands of somebody we never met before as they were dying.
You're the only one talking to the family. You get really in the middle of the emotion.
They're tearful, and a lot of them are saying goodbye because they don't know if this is going to be the last time that they talk to their loved ones.
Wearing masks all the time, the gowns, the gloves, the shields.
You're going to be in that N95 for a while.
You're ending up with pressure injuries on your face. You sweat through your own clothes.
We're all tired. We all just try and take care of each other. You okay?
I mean, even just passing someone in the hallway, you always say, "Are you good? What do you need? What can I do to help you?" We all have each other's backs.
You're crying. On the ride home, you're thinking, could I have done that differently? Could I have brought that family member in sooner?
The hardest part? Definitely just the losses.
This year, I've definitely put a lot more people in body bags than I would like to in my whole lifetime.
The nurses have been the most amazing people in my life, and so I've been bringing them cards and bringing them just little things that my father would have done if he was here.
We have patients that were here for months. Seeing those people go home, you know, those are the good stories.
Seeing that they're really improving, those are things that really keep me passionate about medicine and working in the ER.
For healthcare, this could be the catalyst that pushes us on to greater things.
Our community rallied behind us. We had individuals making face coverings for us. They brought us all sorts of food.
COVID has really taught us that how important it is to check on one another.
We all were equals and we all had something to offer.
Everyone really stepped up.
Their goal was to support not just their organization, but their patients and the community at large.
Anybody who, number one, has stayed around in healthcare during this is impressive.
I have a hospital behind me that's full of people that have continued to respond to the level that's needed.
This team did an amazing job, and I was just so proud of them because their ability to just bring it all together was impactful.
We've been thrown a lot of curveballs, but my coworkers come to work every single day. They work hard, they give 120%, so that inspires me every day to come to this facility.
They just went above and beyond to be there as surrogate family members for people that were just in the darkest hour.
I'm not gonna stop doing something that at the end of the day I truly love doing, just because there are days that are a lot harder than others.
I'd like to tell you one such story. Tricia Olson, nurse director of the Midcoast Hospital ICU, helped administer the Sacrament of the Sick to a patient dying from COVID-19. Tricia suited up and went into their room with swabs and the holy oil. She applied oil to the patient as the priest read the prayers outside the room. Our team set up a video call with the family so they could see the ceremony in real time. Tricia stayed holding the patient's hand and stroked his arm as the prayers continued. The wife, while in deep sorrow, was comforted by seeing Tricia perform this small act of love that the wife would have done if she could have been with her husband. At a time of great grief for the family, that selfless act of compassion brought the only bit of comfort the family had experienced in over a week. Not everyone would have felt comfortable stepping into the middle of a deeply religious event and performing the actions of a priest, but Tricia was ready to do whatever it took to bring some comfort to this family under difficult circumstances. When we all started working in healthcare, whether it was 3 years ago or 30 years ago, we never could have imagined that we would all face all that we have experienced with COVID-19. Tricia's story is just one of so many from around the state. The past few years have not been easy, but when our communities needed us, we all stepped up. You make me so proud to live and work in healthcare in Maine. You are true heroes.